Welcome guys to this really exciting and very cool episode that I've wanted to do for a long time, just sometimes obviously we're time deprived. So what is today's topic? Brain trauma. It's something that has happened to a family member. That family member was my partner. We were overseas a year ago and she contracted a virus. I had it first and I was quite unwell. And then 2 days later at night time, she just said, I'm not feeling well. So I was like, okay, you must have what I have. So she got up and she went to the bathroom. And as she made her way to the bathroom, she just collapsed. Her body just went limp and all the body weight obviously doubled and she just hit the ground. I couldn't get there in time. It just happened that quickly. From what we understand now, obviously her temperature went through the roof and her body shut down. As she fell, she hit this side of the face flat out, but she hit the door stopper that was sitting there to stop the door going back, which bulged out. So it smacked her right in the head. All her face was instantly black. Lucky we had a hospital next door. We took her to that hospital in Hua Hin, Thailand. They were very, very good. They saw her instantly. They did tests. They had to stitch up her head. They did the scans and then they just kept an eye on her and every day just changed the dressing. So they couldn't see anything on the scans. And obviously my poor partner was in so much pain. Her face was literally black. So was that the end of it? No. We very shortly came back to Australia, and as we came back to Australia and she restarted her work, which she works in childcare, she could only do 3 to 4 hours a day and she had to come home. What was going on? She reported to me that sights, sound and noise was amplified to levels she's never seen before, so it was obviously causing a lot of distress. What else was going on? She just had instant depression. So she hasn't had depression, but the depression came on instantly and it was on levels she's never seen before. I could obviously see it and she was in a lot of distress. She was crying and sleep went instantly. No sleep. We obviously came back. We went to see some doctors. They ran some more tests and ultrasounds and so forth on the brain. My partner saw 2, possibly 3, and they all said there's nothing on the test. Most likely you have really bad jet lag. Go home and take some Panadol. As I heard this, it unfortunately put me off the medical field even more than I've been put off lately. So anyway, that was the outcome. Crying, despair, and in severe emotional and physical pain and no sleep. So what did we do? We obviously asked the doctor, could you give something at the moment, a sleeping tablet, just so she can sleep? So they agreed on that. So that obviously helped partial. But the pain and the depression and the sensitivity to noise and sound wouldn't go away. So I've always been very, very intuitive. And whenever I've worked with someone or a patient of mine, I always connect with my heart. And in that, I connect with the person and I also inside myself ask, I call it an energy. I call the energy inside of me and every human has and this planet holds. It's called love. Love with authenticity. Those 2 words are the most highest words in the English dictionary in all of the English language. It means love that has no bias. It hasn't been manipulated or changed in any way, and it's looking for the best outcome. So I just inside myself and inside me, for my inner wisdom, started asking love. I said, there's something out there. There's something we're missing. There's something, obviously the medical field have no idea on what can help her. So I was drawn to go and see a good friend. His background is a naturopath. He works down at Sporty's Warehouse, Supplement Nutritions. So guys, if you ever need supplements, please go and see him. He does incredible prices, but he cares about each individual who comes in. And to a certain degree, he will help you with things that are outside the box that people can't click onto, meaning the medical field. So I went down and I told him what's going on, and he goes, okay. And he goes, yeah, just let me just have a think. I'm having a think. And he goes, oh, okay. He goes, years and years ago, there was this friend of mine who was a professional boxer, and he copped a massive hit to the head. And same kind of thing. The pain was just there. It wouldn't alleviate. And he goes, he got complete success through hyperbaric oxygen chamber therapy. I went, okay. So I started researching everything on the Gold Coast for that. And then I also started looking at previous cases because they have different levels. They have obviously one called a soft shell, which a soft shell only will handle up to 1 bar of pressure. So it's limited. It has health benefits, but it's not for head injuries. Then as I started researching, you needed 1.5 to 2 to turn back and heal the brain injury. So I looked all on the Gold Coast, I looked everywhere. There was only one place. They had up to 3 bar hospital grade. So we thought, okay, great. We went in. They were very caring, but the prices were they were ridiculous. They're for the wealthy. And if you're not wealthy, there's nothing they can do for you. It was $250 an hour. And she needed, at least from what I started studying, she needed 30 sessions of it at 3 sessions a week. So I researched everywhere on the Gold Coast, and I finally found one at Chugan with a beautiful person that I do know now. Her name is Tash, IV Wellness Centre at Chugan. She has a hyperbaric oxygen therapy that goes to 2 bars. So we got Claire in and we started her straight away, 3 times a week, and just kept it running for 30 sessions. What did we start noticing within a week? The noise and the sound amplification stopped. A week and a half plus, but we'll go into that later. I was using some other things to help her. Week and a half, the sleep started to come back, but the depression spun around from absolutely excruciating, where she was so sad and she didn't know where to turn. It just turned it off. 2 weeks onwards, it just got better and better and better. And at the end of it, she made a full recovery. I'm making this podcast for anyone out there who's had a brain trauma injury. Usually, you've hit your head, you've come off a bike, you've been in a car accident, you're a boxer, you're a martial artist, you've been hit hard in the head, and these symptoms persist, but the medical field has no clue. How long have these hyperbaric oxygen therapy been going? It's been going since the 1800s. It's been going for a very, very long time. Obviously, they used it for divers who got the bends, who came up too quickly. So why does it work? As an impact hits your head, your brain automatically puts out between the skull and the brain a protective layer of gel to protect it. But it doesn't release it. And that pressure then, plus obviously the injury site, causes the pain. So what happens in the hyperbaric chamber therapy? It starts releasing the gel that was released to protect you, but then that starts releasing the pressure, plus the oxygen gets into deep layers through your skin, into the cells, into the damaged area, and the oxygen gives it what it needs. I used a couple of other things to help her. I used Methylene Blue. What a great healer of the brain, the heart, and the gut. It helped all the processes of the wiring that was damaged to be rewired, but it also is used to get extra oxygen into the blood supply, into the cells, into your brain to repair. And I also used another product called BPC 157. This, with just keeping noise down, getting her to bed early and so forth, healed it. So I really wanted to make this short but beautiful podcast. I don't want anyone out there who's either undergoing it at the moment or has undergone it and they're still suffering from those things to sit there in chronic pain, in depression, somewhere in their house, not knowing what to do because the medical field and it's not their fault. They just don't understand the human body and they're limited to prescription drugs and only what's given to them in the field. And most of the time, like it or not, they scratch their heads. So please, guys, if yourself or a loved one has had a brain trauma injury, please go and get hyperbaric oxygen therapy. It is the major key to heal it, and it will heal it. Why did I go to Tash? Tash had the right machine. She had up to 2 bars. We needed 1.5 to 2 bars. She's very good, but her machine, she makes it affordable for everyone. So no offense to the other clinic, and I won't name them. When you're charging $250 an hour and someone comes into you and they don't have much money and they're crying, they're in that much pain, and you understand that your machine can heal it. It's not very cool, I don't think, but obviously each to their own. And you haven't just got one machine, you've got multiple machines on that case of that institution. You either don't get the therapy or you get the money from somewhere, but like it or not, this institution, and I just find it a little bit strange, guys, they had a loan system ready set up for anybody who needs to have a loan. We can get you $4 or $5 grand like that so you can get your therapy. What about a little bit of compassion, guys? And even doctors out there, I'm not trying to be cruel. I've come across some cases on myself lately through different things. I just needed testing and so forth. Just said, I'm a little bit short of money. Can you bulk bill? Oh, not really. No. But you do understand that the results I need will give me indications of where I need to go and what I need to do. No, that's not my problem. So compassion, guys. But Tash at IV Wellness at Chugan on the Gold Coast, it was around $70 to $80 per session. It is doable. And obviously, even if that's a little bit much, then you just ask family and friends. You say, hey, we really need this money. Please get it to us. So this is really a healing blessing. It does work. It has worked since the 1800s. I've done a lot of research on these incredible machines. And what they do is astronomical, guys. But also, guys, it has a lot of therapies for cancer, because a lot of cancer people, unfortunately, are oxygen deprived. So getting oxygen into them actually helps the good cells have a better survival rate, which then obviously helps them to progress to beat the cancer. So I really wanted to get this talk out. Please, guys, if you hear this and you know someone who is experiencing this or has had it, and they haven't had any relief because they don't understand that hyperbaric chamber therapy is out there, please send it to them. I'm doing many podcasts on things I've come across that people really need to know, because there's nothing out on main media. There's nothing your doctors know about this. They just scratch their heads. And sadly enough, for a person in that much physical and mental and emotional pain due to the hit, you've got bad jet lag, please go home and take some Panadol. That's very sad. So please don't be discouraged. Please use this. If you've ever had this, please go and get it done, and you will see it as I've seen it with my own eyes. Within a week to a week and a half, it's spun around 180 from severe to good, and then it just got better and better and better. So I send my love. Please send this to anyone who is suffering from this, and we'll put out a lot more podcasts that are short but accurate and straight to the point, so you don't have to live your life in pain. See you later, guys.